Chronic lymphocytic leukemia, or CLL, is a clonal malignancy of mature B lymphocytes, characterized by their progressive accumulation in the peripheral blood, bone marrow, and lymphoid tissues. It is the most common adult leukemia in Western countries, typically affecting individuals over the age of 60. CLL is often indolent, and nearly half of patients are asymptomatic at diagnosis, with incidental findings of lymphocytosis during routine blood work. When symptoms occur, they include painless lymphadenopathy, splenomegaly, fatigue, night sweats, weight loss, and frequent infections. Autoimmune complications such as hemolytic anemia or thrombocytopenia may also be seen. Diagnosis is established through complete blood count, or CBC, which reveals persistent lymphocytosis. Peripheral blood smear, showing small mature-looking lymphocytes and smudge cells. Immunophenotyping via flow cytometry, confirming clonality of CD5+, CD19+, and CD23+ B cells. Molecular testing and cytogenetics, identifying mutations such as DEL 13q, DEL 11q, DEL 17p, or TP53 mutations, which guide prognosis and therapy. CLL involves genetic alterations in B cells that disrupt apoptosis and promote survival. Frequent deletions on chromosome 13q are associated with favorable prognosis, while deletions on 11q or 17p and TP53 mutations indicate poor outcomes. Recent studies also highlight the role of dysfunctional microRNA regulation and immune evasion in CLL pathophysiology. CLL affects approximately 4 to 5 per 100,000 individuals annually, predominantly in older adults with a slight male predominance. A family history of CLL or other B-cell malignancies modestly increases risk. Early-stage asymptomatic CLL is typically managed with a watch-and-wait approach. Treatment is initiated upon symptomatic progression or high-risk features. First-line therapies include BTK inhibitors, such as ibrutinib and acalabrutinib, BCL2 inhibitors like venetoclax, and anti-CD20 monoclonal antibodies, for example, rituximab and obinutuzumab. Traditional chemoimmunotherapy, including fludarabine, cyclophosphamide, and rituximab, is now reserved for selected patients. Allogeneic stem cell transplantation is rare but may be considered for refractory cases. CLL exemplifies how molecular biology has transformed management of hematologic malignancies. With the advent of targeted oral therapies, most patients can achieve long-term disease control, even in the absence of a definitive cure. This material is intended for educational purposes only, and should not be used as a substitute for professional medical advice, diagnosis, or treatment. Subscribe and learn more every day.